Jersey is in the midst of an opioid abuse epidemic. More than 3,000 people in the state died of a drug overdose in 2018.
As a physician, I'm particularly troubled that 80% of people who use heroin first misused prescription opioids, which were often prescribed for an injury.
I went from 125 pills a month to 1,400 pills a month. I'll say that one more time for everybody that's sitting up there. 125 pills a month to 1,400 pills a month. I could have killed everybody in the front row with how many pills I was taking monthly.
My story is going to scare them, I hope. The problem is that when you're sitting at home and you're suffering in silence, you know, the attributes that helped me get to the NFL actually held me back from asking for help, because if you ask for help in football, you're weak. You should be able to do it by yourself. So for me, it's more of a message of it's okay to ask for help. It's okay to say, I have a problem and can somebody help me? And maybe I wouldn't have been an addict for 3 years.
We have to realize that this is a disease. It's a disease. It's self-inflicted, but it's a disease. We have to embrace it. We have to keep fighting.
Be alert to the signs and then ask for help. And don't be afraid to confront your child, because you love your kids and you want to make sure that they are healthy and successful and doing the things that they want to do. And this disease really kind of takes your brain over. And so the kid that you knew and loved all those years is still in there. You just have to work through and get the professional help that's needed to be able to bring that kid back to you.
You feel like you want to scream at an addict because you want them to change, but it's like screaming at cancer. And what effect would that have? How successful would that be? And you have to understand it as a disease and the impact that it has upon you.
You can address it early on. If you can bring the warnings to young people who may have a sports-related injury, for example, and they get prescribed something, to talk early on about the dangers of it, both for the parents and for the students, then hopefully we can avoid other tragedies in the future.
If I reach one of you guys that are sitting there right now that might be taking pills and know that I survived it, so can you. You know what I mean? So any chance I get to talk about this stuff and to relate to these young men and women and parents and coaches and teachers is that it can happen to you at any time.
Horizon's an incredible player in public health, and I think for them to bring us together in this forum is an important part of the conversation. And it really, again, it's all about, the more we talk about it, the more we draw it out of the shadows, the more we draw the stigma from addiction, the more people feel comfortable seeking help. And that's what it's all about, getting people to help and preventing people from getting on that path to addiction.
It's a team effort. It's got to be an issue that's addressed by the entire healthcare professional organization as well as by patients and their families.